We are 1.5 years into this epidemic, and during this period, the evidence have changed, and with the advent of vaccine, the advice regarding some basic preventive measures in COVID-19 has also shown marginal changes. We would today look into those that are affecting quarantine and isolation today, because these changes, differing perceptions, cause sometimes confusion in the minds of the lay public. Many people don't differentiate between quarantine or confuse between quarantine and isolation. To understand the difference, it's better to know the natural history of a disease. Now you have a population that's susceptible. They get exposed, say, to COVID-19, and then the virus starts multiplying in your body. But at that time, you may be asymptomatic, and then you have the onset of symptoms. When, of course, usually the diagnosis is made. The time from the exposure to time of the first symptom is known as the incubation period. This is important because during the incubation period also, you are infective. You are the late stage, especially you are infective. And sometimes, therefore, when you are in contact with the person, unless you take action, you are likely to spread the virus in the community. Therefore, quarantine is used to separate someone who might have been exposed to COVID-19, and may develop illness away from other people, And the quarantine's importance grew after it was evident that persons are able to transmit COVID-19 before symptoms develop, and that a substantial portion of infected persons, like somewhere between 20 to 40%, never develop symptomatic illness but can still transmit the virus. Therefore, I might get exposed, I may develop an illness, I may never develop a symptom, I will transmit it to 5 or 10 people and nobody would come to know. Therefore, unless persons who are in contact are quarantined, you are never going to prevent this exponential explosion of this disease. Quarantine is intended to reduce the risk of that infected person might unknowingly transmit infection to others. And the quarantine period, the recommended for a 14-day quarantine, was based on estimates of the upper bound of the COVID-19 incubation period. Now, the incubation period is quite varied. They say it varies from 1 day to 14 days. But more than 95% is over by after 7th day, people are not infected. By abundance of caution, the CDC even now, and most of the WHO and others even now, recommend a 14-day quarantine from the time you are exposed. This is a pretty long time. What is a close contact or a significant contact according to CDC? You are within 6 feet of someone with COVID for a total of 15 minutes or more. You provided care at home for someone who is sick with COVID-19. You had direct physical contact with the person, or kissed him, or probably even hand shook him. Therefore, it's better to say namaste than shaking hands. You shared eating or drinking vessels. This is very important. This is the reason why people there is a ban on eating in the hotels, but you can carry home the food. Or they sneezed or cough or somehow got respiratory droplets on you. Mind you, this is it is there in the CDC website even today. But now there is more and more evidence that COVID-19 virus is being spread by airborne and not by droplet alone. Therefore, this close contact may not be required. Even above more than 6 feet away and little distance, less than 15 minutes may be enough. But they have not updated those in the website yet. CDC makes 2 exceptions for quarantine for people who have a close contact with someone. One is excluding people who have had COVID-19 within the past 3 months, because they don't expect a person to get a second COVID, at least if you have already suffered from COVID-19 within 3 months. And they make another exception, those who are fully vaccinated. Now, people who have been in close contact with someone who had COVID-19 are not required to quarantine if they have been fully vaccinated against the disease and show no symptoms. Now, this may not be applicable to our place, or probably is not applicable to our place because our vaccines are only 70 to maximum 70% effective. And we have a population which is very much susceptible. They are talking about United States of America, where they have a vaccine which is about 95% effective, and they have vaccinated about more than 50% of their population. But this is one of the things we should understand. These things may come in WhatsApp and other messengers, and you must understand that you will have to at times listen to the local authority rather than to a well-known international authority. And you have to customize good international advices to your own conditions also. When you look at the local practice, I mean, I am practicing right now in Kerala state, and now summary of COVID and quarantine isolation guidelines on the 21st of April 2021. Most of the states in India are having very good websites. And now in 21st April 2021, they have come about with quarantine and isolation guidelines. I just want to point out two facts here. Uh, they talk about high risk primary contact, and they say 14-day room quarantine. Therefore, they also agree uh, room quarantine or home or institution quarantine. I don't know why they make it. What they mean is that the room quarantine within the room, home quarantine, you are inside the room, but you mix with the other family. What I understand is they have planned for 7 days, and then after 7 days, they ask you to do an RT-PCR. If it's negative, you change over to the home quarantine. But anyway, that's not the significant. They do agree with the international guidelines of 14-day room, but they make a statement here: high risk primary contact and a low risk primary contact, in which the low risk they say 14-day, avoid all non 14 days. They just make a mention 14 days, and the rest of it is just COVID appropriate behavior. But when I contacted the authorities, they told me the high risk contact is a real close contact, which we have referred to already. The low risk is when people don't meet the criteria of a close contact, like somebody has talked to you for 5 minutes, or you met somebody somewhere in a shop, and later on you were standing in the queue behind him for 10 minutes, and he later turned out to be positive, etc. These 14 days they are not telling it is quarantine, but they are just telling COVID appropriate behavior. Now, if I checked it with the Ministry of Health India, but Indian Ministry of Health website, but they don't talk much about quarantine at all. They talk only about isolation. Therefore, this definition of high risk and low risk, I didn't find it anywhere else. But anyway, I think this is an action by the Kerala health authorities to elevate the mental agony of people by telling them be careful for 14 days, that is all. But when there is a close contact, they go with international recommendations of 14 days room or home quarantine. Now, some of you might be surprised that I talked about 14-day period of quarantine, which is supposed to be ideal because that is the highest limit of incubation period. Now, there's a big cry both from the public and individually to reduce the length of quarantine. And even community people epidemiologists are aware of the fact that this will increase the compliance. If we ask for 14 days, hardly anybody may not do even 1 day of quarantine. Therefore, they want to reduce it. Therefore, what they do is quarantine can end after day 10 without testing, and if no symptoms have been reported during the early monitoring. Even they talk about day 10. After day 10, you can, without testing, you can do. That's what the CDC says. Now, I'll come into details later. Now, when you do like this, with this strategy, there is a price to pay. That is, with this strategy, the residual post-quarantine transmission risk is estimated to be between about 10% and the upper limit of between 1 and 10%. Therefore, instead of 14, you make it 10. Then there is a chance between 1 and 10% that you might transmit the disease. But when they give certain advice, what the WHO look is the balance between how the compliance by the community and the real science. Therefore, they feel that if they reduce from 14 to 10, compliance will increase so much better that it is better to reduce the quarantine to day 10 without testing. The quarantine can end on day 7 itself if you are able to do an RT-PCR test on the day 5 and within 48 hours get the result. Now, if you do that strategy, if you reduce it further from 10 to 7, there is a price to pay that the post-quarantine transmission risk is estimated to be about 5%, 5 to 12%. Therefore, there is a risk to pay when you reduce the transmission. But when you have to balance between compliance and actual signs of incubation period. And many states are now trying to reduce the infection period, the quarantine period, because 14 is too long. But the state of Kerala is holding on to 14 days. Isolation separates sick people with a contagious disease from people who are not sick. Now, this also prevents transmission. Therefore, when you are sick, usually it is diagnosed with the onset of symptoms. Sometimes at the late in the stage of quarantine, when you know somebody is in contact with COVID-19, late in the stage you may do a PCR, now is asymptomatic, and you might again, the PCR may come as positive. Therefore, he can be asymptomatic also. Therefore, you might detect it at this stage also. Now, transmission after 7 to 10 days of illness is unlikely, particularly for otherwise immunocompetent patients. This is the principle of isolation, actually. Now, in this group of patients, someone who has a positive PCR test and no COVID symptoms. Now, you would have done a PCR and as a screening in the community, or you would have done it in a contact person. If he has no symptom, the day of the test is counted. Then now let's find out how we calculate the isolation period. The day of test is counted as day 1, and then you start watching for symptoms. If no symptoms appear, you isolate for 10 days. Therefore, day 1 is a PCR test positive. Isolation for 10 days from the day of the positive test, discharge on day 11. If his symptoms develop, then we go to the next slide. Now, the usual group of patients is a symptomatic COVID patient with a positive PCR. Here, you isolate him always, includes 10 days from the symptom onset, plus additional 3 days without symptom. Therefore, the minimum isolation period is 13 days, with the release on day 14, or later if the symptom persists. Now, let's look at in a little more detail. Suppose the symptom starts on day 1 and lasts up to day 10. Therefore, there is 10 days of isolation plus 3 days of isolation without symptom. Therefore, you discharge on day 14. Therefore, this is the least number of period. But sometimes what happens, the symptom persists more than 10 days. Isolation continues throughout the whole period, plus 3 days isolation without symptom. Discharge from isolation on the 4th day without symptom. Therefore, isolation period depends on how many period, till what time you are symptomatic. If you are having cold and fever on day 17 and it stops only on day 18, another 3 days of asymptomatic isolation is required. There are some significant differences as far as CDC guidelines goes when compared to WHO. For example, CDC also agrees that for most adults on COVID-19 illness, isolation precautions can be discontinued after 10 days of symptom, after resolution of fever for at least 24 hours without use of fever-reducing medication and improvement of with improvement of other symptoms. Therefore, there they talk about 3 days of symptomatic period. Therefore, cold and cough also comes into this. CDC doesn't take into that, and they give only 24 hours without fever. Therefore, you can isolation becomes a little easier in the CDC goes. But they talk of something else. Some adults with severe illness, this is for mild and moderate diseases. For severe illness, but I didn't find it what definitely they mean by severe illness, may produce replication competent viruses beyond 10 days and may warrant extending duration of isolation and precautions up to 20 days of symptom onset. Therefore, for severe illness, you will have to take it on an individual basis, and it may be between 10 and 20 days. And severely immunocompromised patient may produce replication of the competent virus beyond 20 days and require additional testing and consultation with infectious disease specialists and infection control experts. Therefore, note the differences. For a normal person, which are normal people whom we meet, it is 10 days with at least 24 hours in which the patient is having no fever. But for severe illness, it may vary any time between 10 to 20 days. And severely immunocompromised patients, you will have to depend on an RT-PCR test and take the expert opinion. One thing you have to notice for normal persons, RT-PCR test is no longer used to decide when to discontinue the isolation. A positive RT-PCR only shows the presence of antigen, and it doesn't mean, and genes, it doesn't mean that live virus is present and the patient is infectious. Therefore, RT-PCR is removed. Previously, we used to do an RT-PCR before the patient is discharged from the ward to decide whether he can go home. Now it is no longer recommended. Therefore, but for adults who are severely immunocompromised, a test-based strategy will be considered in consultation with infectious disease expert. For all others, a test-based strategy is no longer recommended. A time-based strategy is what is used. The Indian Ministry of Health, just 3 days ago, on the 5th of May 2021, has produced a guideline when to stop the home isolation. It more or less agrees with the CDC guideline, isolation for at least 10 days. But it talks about no fever for 3 days. You know, if you remember, CDC talks of no fever for 1 day. Therefore, they have slightly made it little different. But maybe they are customizing it for Indian conditions. And remember that WHO talks of 10 days plus 3 days of asymptomatic period. Here, both CDC and the Ministry of Health talks about fever, but one talks of 1 day and the other talks of 3 days. Now you're supposed to practice the local guidelines, follow what exactly the local government tells you to do. Now, if you look at the Kerala government and the annexure COVID-19 policy in 25th April 2021, probably just less than 1 month ago. I don't think anything has come after that. It is asking about the discharge policy. We are interested what they say about isolation. They say the home isolation for a total of 17 days from the symptom onset or from the day of diagnosis in case of asymptomatic patients. Therefore, it's definitely different from what we have seen in the WHO guidelines. Therefore, these are how sometimes confusion arises even in the minds of the doctors. To illustrate the fact that how long one should isolate may not be always straightforward, I pick up a case from the New England Journal of Medicine in March 10, 2021, which they said a woman with COVID-19, doctor, how long should I isolate? There is two opinions. Opinion one recommends, by two experts actually, recommends continued isolation, and the other expert says the no need to continue the isolation, reassure the patient and stop the isolation. We'll run through the case to illustrate how isolation can at times be debatable even with all this evidence before us. Now I'll give you a summary of the case in question. A 24-year-old woman with no relevant medical history presented to emergency with a 1-week history of cough and shortness of breath and no fever, and hypoxemia with an oxygen saturation of 88% on admission. Crackles were heard on the lung on auscultation. A chest X-ray showed bilateral interstitial opacities with RT-PCR test positive for COVID-19. Her oxygen concentration increased and she was given supplement oxygen at 15. Oxygen requirements increased and she was given supplement oxygen at 15 liters per minute after admission through a non-breather mask and was admitted in ICU care. Now, if she improves within 1 week of period of admission, the patient plans to go home to stay with her parents, both of whom are over the age of 65 years. Note here, she came with a 1-week history. She stayed in the hospital for 1 week. Therefore, she is too weak into her illness. She reveals now that her father is taking immunosuppressive medication after a recent kidney transplant. She demands and gets a PCR test done, which comes as positive. And therefore, now the option before you is one, recommend continued isolation. She's on the 14th day, mind you. And two, reassure the patient of low risk of transmission. Which will be the options? Two experts debate this. The first author puts forward her reasons for her conclusion. Now she says early in the COVID pandemic recommendation, CDC included discontinuing isolation when there was a negative RT-PCR test and clinical improvement. This recommendation has been replaced by a time-based approach rather than a test-based one. That's what we know very well about. Now, the RT-PCR in COVID-19 respiratory specimen beyond 10 days after the onset of symptom did not grow in cell culture and was probably not transmissible. Why they dropped it is because RT-PCR positive, but cell cultures were negative and therefore not transmissible. However, a few studies have recently challenged this concept. There will always be contradictory studies in science. But the overwhelming evidence is in favor of not doing RT-PCR test. And the author goes on to say that an RT-PCR test was not indicated to find out the duration of isolation in this patient. But however, this patient got it done because she demanded it, probably, as it often happens. The first author continues to point out that the CDC currently recommends isolation for patients for 10 days after symptom onset with a fever-free period of 24 hours with extension to 20 days for immunocompromised or those with severe illness. She points out that 10 to 20 days is a period for patients with severe illness, and she goes on to point that the patient described has severe infection. Because she required high flow oxygen, mind you, she did not require intubation and stayed there for only 7 days. This will be a point of contention according to World Health Organization severity scale and CDC criteria. I looked up this organization severity scale and CDC criteria. I couldn't find where they are. Thus, continuing isolation for a total of 20 days seems reasonable in accordance with the current evidence. Therefore, it's a severe illness. She says it's better to continue. And she also points out in the current case, there's a household member who is a kidney transplant recipient, a condition which the COVID infection associated with high morbidity and mortality, which further justifies a 20-day isolation. Therefore, a severe illness, along with the fact that there is somebody in the house who's highly prone, all this makes, she says, you can extend it for a further period beyond 14 days. Therefore, the recommendation is continued isolation by this author. The second opinion or the counter opinion is, though she spent several days in ICU, her course was moderate, not severe. She was persistently febrile. It's moderate because she was never intubated and only moderate changes on chest radiography. I think this is more or less right. Reports suggest that patients with COVID-19 who are older, male or obese, who are immunocompressed or who have severe disease have longer than average periods of shedding virus. This patient had none of the above characteristics and would not be expected to have a prolonged viral shedding. Here the patient himself or herself is not immunosuppressed, and therefore she says there's no chance of it, and none of the risk factors, no chance of it shedding virus. She backs her argument by pointing out that in February 2021, the CDC, citing their own unpublished data and those from other sources, stated that in patients with mild or moderate COVID-19, replication of competent virus hasn't been recovered after 10 days following symptom onset. She says even in severe illness, the vast majority of patients admitted to ICU and intubated, the probability of isolation of virus after 15 days was only 5%. Therefore, in summary, a 24-year-old woman with a moderate COVID-19 infection and no markers for extended viral shedding has a positive RNA detection, RT-PCR is positive, yet probably has no replication competent virus. Therefore, the RT-PCR is of no significance because it doesn't show that there are live virus. And she has little probability of transmitting SARS-CoV-2 virus to an immunosuppressed family member at home. And she goes on to recommend reassure the patient of low risk of transmission, no need for continued isolation. They were different opinions, world-renowned authors, world-renowned journal. But for me, common sense, I would go with the first one, because as far as India is concerned, if a patient with a renal transplant gets the COVID, and even if he survives, he's not going to get another renal transplant. That's the situation, ground reality. Regarding quarantine, there seems to be an agreement of 14-day quarantine, both by the CDC as well as by the WHO. The DHS, or the Director of Health Service of Kerala government, also in high-risk primary contacts talks about 14 days home quarantine or institution quarantine. High risk, it means significant contact. But it also talks about a low-risk primary contact, which will not be taken up as a significant contact internationally, just talking to somebody for less than 15 minutes, or seeing somebody in the lift or something like that. This is mainly to assuage the feelings of mental agony of the patient, of the concerned person. Now they talk of 14-day avoid non-essential travel, and it amounts to only COVID appropriate behavior. They are not telling about real quarantine for these patients. Now, shortened quarantine is something which CDC also recommends to a certain extent, because 14-day quarantine is too much. Many patients will not comply with it at all. A shortened period would be welcome for them, and very important for the health authorities, because they are facing severe shortages. Therefore, a 10-day quarantine without testing, if asymptomatic during the period, or a quarantine of 7 days with RT-PCR, or day 5, if it comes negative, you can stop the quarantine. But both of them have a chance that you will spread the infection somewhere between 1 to 10 and 1 to 12%. Therefore, there is a price to pay for it. In fact, some of the states in India have found that they quarantine for 7 days even without testing. Because you have to strike a balance between theory and what is practice, which is practicable, and also the compliance of the patients is very important. To recap regarding isolation, the CDC says 10 days after symptom onset with resolution of fever for at least 24 hours for a normal person. Now, if it is more severe disease, is 10 to 20 days of isolation. And if immunocompromised, maybe more than 20 days, going by the RT-PCR test. Now, if you look at the Ministry of Health, they recommend almost the same thing. Only thing is 10 days of minimum period, plus without fever for 3 days. Since here the CDC says only 1 day, here it says 3 days. Subtle but significant differences. And if you look at WHO, 3 days without symptoms. It doesn't say fever. Therefore, even a cold and cough, if you have, you should have gone for at least 3 days before you stop the isolation. Therefore, these are significant differences. But borderline, it is around about 10 days. But if you go by the Kerala government or the DHS office website, it says for a home isolation straight of 17 days, which I think requires a relook. Now the topic of quarantine and isolation may look very simple topics for having to discuss so much in detail, but advising unnecessarily unscientific long quarantine and isolation, the complaints goes down and the public also get confused. And often changing the duration also causes doubts in the public mind, lay mind. But of course, with changing evidence, one will have to change the advisory also. But as far as possible, it should be based on evidence. That's what I have tried to portray in this presentation. Thank you. I am Dr. A. Padmanabhan, and my other YouTube whatever I have scientific YouTube presentations are there in this link. And goodbye till we meet next time.